Hello friends, today we are going to learn about hyperthermia. The hyperthermia is different from fever. Fever and hyperthermia are two different things. They may look similar, but the main difference between fever and hyperthermia is hyperthermia is characterized by an uncontrolled increase in body temperature that exceeds body ability to lose heat. The main difference between fever and hyperthermia is in fever, the hypothalamic set point increases, but in hyperthermia, it has nothing to do with that hypothalamus thermoregulatory center set point. There are many reasons for the causing of hyperthermia. They may be due to heat stroke. In the heat stroke also, this is a new point, that is that difference between exertional and non-exertional. Exertional, we of course know, we can see in the laborers who do physical work in hot environment. Other than that, under exertional, drugs like anticholinergics also may come. Non-exertional, in the non-exertional, what is the difference between the exertional and non-exertional? Non-exertional is generally seen in elderly individuals which are locked in rooms with no air conditioning, or elderly individuals on drugs which are having anticholinergic side effects like antipsychotics, first generation antipsychotics, etc. These individuals we can see non-exertional heat stroke. And drug induced, they may be different drugs due to cannabis, they may be due to cocaine, amphetamine, or LSD, or these type of drugs. And there are three types of syndromes which we actually get confused. They are malignant hyperthermia, neuroleptic malignant syndrome, and serotonin syndrome. These three are actually many different things, and people usually get confused between them. The difference between these three, I'll tell you the characteristic points. Malignant hyperthermia occurs only in some individuals which may be genetically predisposed. For those individuals, they may have reaction to either anesthetics like succinylcholine, etc. It develops within minutes. Generally, it's seen in OTs, and it's actually often fatal. And coming to neuroleptic malignant syndrome, as it suggests in the name, neuroleptic itself says that it is caused due to neurolepsy, means antipsychotics like that type of drugs. It is generally, there is a history of usage is there of the drugs, and it is mainly characterized by lead pipe rigidity, extrapyramidal symptoms, and autonomic dysregulation. These will be seen generally in the neuroleptic malignant syndrome. And serotonin syndrome. Serotonin syndrome is also caused by SSRIs and MAO inhibitors, where we also know it reacts with the cheese, etc. So the difference between here is that it is distinguished by presence of diarrhea. And other than, as we said in the neuroleptic, it was lead pipe rigidity. Here is different. It's myoclonus. So the main difference is malignant hyperthermia. It occurs in minutes in genetic predisposed individuals due to reaction to anesthetics. Neuroleptic malignant syndrome, it's characterized by autonomic dysregulation and lead pipe rigidity. Serotonin syndrome is seen in presence of diarrhea, tremors, and myoclonus. So don't get confused in this. This is an important point. And the difference between fever and hyperthermia, as we said earlier, the main difference was in fever there was a rise in the set point by the hypothalamus, and hyperthermia, as we said, there is no rise in the set point. And characteristically, fever responds to antipyretics, whereas in hyperthermia it does not respond to antipyretics like aspirin or paracetamol. This is the important point. And the small characteristic difference between fever and hyperthermia is, in fever, actually in skin there is vasodilation and the skin tries to lose heat, whereas it's different in hyperthermia. We may see that patients hyperthermia is caused by some drugs like anticholinergic effects, so skin may be hot, whereas not like cool. which occurs in fever. So these two are little points using which we can distinguish between fever and hyperthermia and the types of hyperthermia. Thank you.